Hi, I'm Prof. Ong, Chairman of the Expert Committee on COVID-19 Vaccination. In the past 2 years, we've seen what COVID-19 can do and the devastating impact it can bring to our lives. But we are no longer powerless in this fight against COVID-19. With vaccines as an essential part of our defenses, we can now protect ourselves and our loved ones. So how do vaccines protect us? Vaccines teach our immune system to recognize and fight the COVID-19 virus. They make a person less likely to be infected and reduce the likelihood of spreading the infection. mRNA vaccines reduce the risk of infection by at least 40% against the Delta variant and reduce the risk of severe infection by at least 90%. In fact, our data shows that a fully vaccinated person is much less likely to be critically ill or to die from COVID-19 infection as compared to someone who isn't fully vaccinated. This protection is particularly important for our elderly and the vulnerable in our population. Other vulnerable groups include pregnant and immunocompromised individuals who should not delay getting vaccinated. People who are grossly overweight or with underlying conditions also tend to have greater risks. And those who are younger. This does not mean that they are immune to COVID-19, so it is vital for you to get vaccinated as well. I know some of you are concerned about the safety of the vaccines, but I assure you that the vaccines are safe. Locally, we have administered more than 11 million doses of vaccines. Some of you may experience mild to moderate side effects, but these generally subside within a few days. In fact, in Singapore, I'm glad that most of our population have been vaccinated. We have one of the highest vaccine coverages in the world. In fact, more than 87% of our population has been fully vaccinated, and more than 30% have already obtained their booster shots. There have been reported cases of people developing anaphylaxis or myocarditis after vaccination, but such adverse events are rare. Reported cases of myocarditis have also generally recovered or are recovering. Nevertheless, as an added precaution, we advise everybody to avoid exercise for 2 weeks after vaccination. We understand that there remains a small proportion of people who have not yet been vaccinated, and this puts them and their loved ones at risk. So if you have not been vaccinated, can I urge you to do so as soon as possible? And if you know of someone who has not been vaccinated, please encourage them to do so. Let's all do our part to keep ourselves, our loved ones, and our communities safe. Together, we can work to become a COVID-resilient nation.